All right, let's take you now back to our top story. That is, of course, Health Minister Dr. Motsoaledi visiting Rey Hospital, that's in the Northwest province, following the recent flooding there. 30 patients were moved to other hospitals in the area. Let's now welcome Dr. Motsoaledi to just unpack what is happening there. Minister, thank you so much for your time and a very good afternoon to SA today. So hospitals were not spared from the severe storms that have wreaked havoc in the Northwest province. Please unpack the extent of the damage to the various health facilities that you've been to and how this has impacted healthcare services.
Yes, good afternoon, Unati, and good afternoon to the listeners and viewers. Yes, true, I'm here at Rey Hospital in Lichtenburg because of flooding. There is no damage, Unati, because what happened is this. Because I took a group of engineers and very knowledgeable experts here. They say this town of Lichtenburg got 10% of their annual rainfall in one day. That means the rainfall that should have fallen in 1 year, they experienced it in 1 day. But I'm sure you also know that it falls under the Unemployed municipality, which has been in the news for all the wrong reasons. So when that amount of rain fell, their sewerage, their stormwater drainage system could not cope. And instead of the water passing through the stormwater drainage, it found its way into the gates of the hospital, flooded the hospital. I'm told by the CEO that at the entrance of the hospital, the water was knee deep. It was basically a river, or even bigger than smaller rivers. And then the water went into the wards where it was sort of ankle deep. Now, this hospital it's not a very big hospital. They had 33 patients admitted in the hospital, not 30, but 33. And all of them were taken to other neighboring hospitals, so that the whole hospital is empty now. There's not a single patient, but they've finished cleaning the water. We just doing the final touches.
I would imagine, Minister, that this scenario then at Rey and the context that you've just provided raises many questions in terms of what happens in a real disaster if we were just speaking to flooding, because we've seen bad weather conditions across the country. So in terms of standard operating procedures in an emergency, maybe help us understand how that would look like, especially in the event of immediate evacuation of patients and in a worst case scenario, a total shutdown of a healthcare facility.
Well, this is a total shutdown, Unati. It was not a complicated issue to put people in ambulance and take them. Yeah, it's a total shutdown. There's not a single patient in the whole hospital. Maybe the fact that they say 33 patients, people are used to huge hospitals in the country. This is a very small town. It's not huge at all. The total number of beds in this hospital is only 71, but only 33 were actually occupied. So it was very easy to evacuate them. Even the 71 will have been. The main issue that we need to solve is because now that we know there are problems of climate change, we may experience rainfalls that we have never experienced them before. What do we do with our sewage system? And it was quite unfortunate, some evil of nature, that it happens in a municipality that is as bad as the Unemployed municipality. Because obviously, if their stormwater drainage system were not blocked, the flooding would not have been as severe as the hospital has experienced.
And Minister, perhaps give us a picture in terms of how other facilities are doing in the province. We know, of course, that in the Northwest province, about 3 hospitals were also affected by the flooding. We're now hearing the South African Weather Service warning of more heavy rains in most parts of the country, including that province. I would imagine providing a safe and secure environment for all patients and staff would be a priority for you. So just in terms of contingency plans, what do you have in place? And also just a picture provincially in terms of what you've been seeing.
Well, you remember that disaster management falls under COGTA.
Yeah.
And the MEC said he has already conducted them in case that happens. But perhaps it was sort of over-alarming to say 3 health facilities were affected. All the district chief directors were here, and they reported that the only other facility apart from Rey Hospital in Lichtenburg, the Soweto municipality, the only other facility is in Moses Kotane Hospital in Lihuruze in Zirast. That hospital was affected for only 2 hours. That means operations were only disturbed for 2 hours when the storm water started coming in, more or less following the similar process here where they were overwhelmed by water. But within 2 hours, they've put the situation under control. The hospital was back to normal. Even now, it is back to normal. The other hospitals, they say it was minor leaks here and there on their roofs, but there was no flooding at all and no patients were removed.
Minister, before we played this interview, or before I started speaking to you, of course, we were playing a report you would have heard or seen of a group of unemployed doctors in the Eastern Cape calling on the provincial government there to source alternative funding models to absorb unemployed doctors into the public healthcare system. I mean, we've seen this play out even in 2024 across the country. How is this matter being handled and addressed by your department, Minister?
Well, I've just received a WhatsApp message from the Premier when I arrived here in Rey.
Yeah.
I didn't really study it. I just read the but look, you are using the word absorption.
Yeah.
Yes, you are using the word about absorption. Let me explain to you how the system works. People who we are forced legally to give a job to because it's statutory are doctors who have just qualified, who are doing internship for 2 years. When they finish that, and when they finish, even pharmacists, when they finish that 2 years, they then do community service, which is also statutory. Treasury is forced to look for money, otherwise they'll simply go to court, and the court will force us to. Once you finish your 2 years internship and 1 year community service, you can work anywhere. You can open your own practice. You can work outside the country. You can work in the private sector. You can get your work anywhere. So if you get a job, it's not an absorption. It will have been that the job was advertised because there was money to hire you. And the advertised is just like any other profession in the country. I'm sure you are aware that we do have a problem of unemployment, whether people have done engineering or accounting or BA or law or history, but in health, there is this wrong concept called absorption, which is not the case because every post must be advertised and people apply just like any other job in the public service.
I would imagine, Minister, just as we wrap up, that you will be addressing this matter then, to clarify that, because we had seen in 2024 a number of these protests, also in KwaZulu-Natal and Gauteng, where there is this call for absorption. So it does then leave one to understand that there is also that distinction that people are not really aware of what you've just been explaining to us now.
Well, doctors are definitely aware, that I can assure you, Unat. It's just that we are not used to it. You know, I was the first MEC for education in Limpopo 30 years ago. Well, it's now 31 years because it's 1994. A similar thing happened because before that, people were never used to a teacher who's getting unemployed. They believe once you have got a teacher certificate, then the government has to or owes you a job. And because there was a shortage of doctors during those years, yes, it was like that. I mean, a shortage of teachers, yes, it was like that. Now, 30 years later, the whole thing is coming to the healthcare services, where people are not used to seeing somebody who has got a certificate in medicine not getting employed. But unfortunately, the economy is such that we are forced there. I was just explaining that much as we need them, when they get that job, it's not an absorption. There's nothing called an absorption. When you have finished your internship and you have also completed your community service, you get a job which is advertised like any other, and jobs only get advertised if there's money for that type of job. But that doesn't mean that we don't need doctors. It's because of budget cuts which health have suffered. And this matter is being discussed with Treasury almost every day about how the budget cuts affected us.